Premenstrual syndrome is a very common complaint where you can get depressed or other symptoms, and there are remedies for this, and this video talks about it. I am Dr. Shobhana Mohandas. I work as a gynecologist and laparoscopic surgeon at Sun Medical Center, Thrissur. Why does premenstrual tension occur, and what is it? Just before the periods start, you start feeling upset, you may get pain, and then you may get depressed, you start feeling crying for no reason, you can't handle negative thoughts as much as you could before. These things start 1 week before periods and stop once the periods occur. This is called premenstrual tension. This normally occurs due to the fluctuations in the hormones. In the latter half of the cycle, there is increased progesterone. These fluctuations can cause decreased serotonin, which is a chemical in the brain. That will cause depression. And there may be bloating. So, all these things may affect a woman. It is very nice to talk about it and make fun of it as in movies and serials, but for the woman who is suffering, for her children, for her husband, for her near and dear, it is a distressing affair sometimes. Most people can handle it knowing it is premenstrual and they just manage to tide over it. But for the few who find it difficult to tide over, it is good to take help. Even breast pain can happen. Sometimes bloating can happen. So all these things, if it is beyond your capacity to control, why not take help and live happily in all the weeks of the month instead of only the first 3 months? So this is what I would like to tell you. When you go to a doctor, what do they normally prescribe? Normally for breast pain, I normally give vitamin E and primrose oil, which is a natural element. And these things are very good for breast pain. And I find it useful in all my patients. For other symptoms, minerals like magnesium, zinc, calcium, and vitamins like B6, all these things are very helpful in decreasing the mental tension also. And generally the patients also prefer natural remedies which are included in pills as first line of treatment. If not, giving oral contraceptives pills can also help tide over the hormone imbalance. And sometimes beyond that, you may require drugs which reduce serotonin like antidepressants. Now, beyond all this, food changes can also be looked after to tide over this crisis. It is known in research that ultra refined food items are bad for premenstrual tension, and women who are having premenstrual tension are the ones who are taking these. So what are they? Packet snacks, instant noodles, sugary chocolate, biscuits, potato chips, cakes, pastries. All these things are ultra refined foods and they may be tasty, but they increase your food craving. You take one chip and you feel like going on taking more and more and more, and you can't stop it. So this craving for food can be bad for your psyche also, and you may start getting jittery and irritable. So cutting down all this and substituting it with complex carbohydrates like brown rice, sweet potato, beans, lentils, and fresh food, that can really help. At least in those days, if you can substitute outside food with homely food containing good carbohydrates, it will be really helpful. Drinking lot of water can also be useful. Now, magnesium is a mineral which is very useful for decreasing uterine contractions and thereby the pain. The pain, if it is not there, definitely will reduce your depression. It is also good for improving the mood. Magnesium is rich in ragi, bajra, and some other cereals. Also, it is rich in spinach, moringa leaves, almonds, chickpeas, and substituting normal chocolate with dark chocolate, and fish like mackerel and salmon, and even our plain bananas are rich in magnesium. So taking these foods in those days can be helpful. Vitamin B6 is another component which can improve premenstrual syndrome problems, and they are rich in sweet potatoes, spinach, beans, lentils, rajma, salmon, chicken, pistachios, sunflower seeds. So taking these food items can be helpful. Besides this, food rich in calcium like milk and milk products and leafy vegetables is good. Drinking lot of water is good. Taking good exercise can reduce tension, and so overall lifestyle changes can be helpful. So in short, if a person is having premenstrual syndrome, if it is severe enough to affect her lifestyle, she should go to a doctor and take medications in form of natural products, or natural product containing pills or drugs to remove the premenstrual tension. She can make changes in lifestyle by taking complex carbohydrates, magnesium and vitamin B6 rich food and other things. But there is no need to go through suffering in the 1 week of your periods. I hope this video was useful. Thank you so much.